Is it good? This is Shannon Taylor's physical assessment. This is Ashley Simmons, my BSN mentor. Okay. Okay, as my patient walks in, I'm assessing her gait. Hi.
Hi.
What's your name?
Ashley.
You can go ahead and sit down. Do you know what the date is today?
Yes, it's November 5th.
Yes. Of what year?
2010.
And where are you?
I'm at the doctor's office.
Okay. Are you having any pain?
No.
No. Do you remember what you ate for breakfast?
Yeah, I had a bowl of Cheerios.
Okay, and that's assessing my short-term memory. I'm going to go on. I would do vital signs if I had my blood pressure cuff and all that. Here, I'm going to check my respirations and my pulse. So I would count her pulse for a minute and her respirations. She's probably about 70s. And respirations anywhere right between teens and 20. I'm first going to assess her pupils. I'm going to assess for the reaction, the reflex, and let's see, and I'll look at her sclera while I'm in here. Just make sure the full eyes are normal, there's no ptosis or anything like that. Next, I'm going to go through cranial nerves. So I'm going to ask you to close your eyes, open them, raise your eyebrows, smile, tongue out, and then here I'm also going to check her throat since her mouth's open. Okay, good. I'm going to assess your hearing. Can you hear this?
Mm-hmm.
This?
Yep.
Okay, can you see me here?
Yes.
Assessing peripheral vision. Okay, so I'm going to, how many fingers am I holding up?
5.
How many fingers?
3.
How many fingers?
1.
Okay, follow my finger with your eyes. I'm assessing also for nystagmus. Okay, I need you to roll your hands forward. Now go backwards. Okay, I'm going to push your shoulders up against my hands. Good. Your neck against, your head against this side and this side. Okay. I'm going to have you put your arms up. Try to let me push you down. Okay, other way. I'm going to also do the same thing with your legs. Push your legs up and back. And then I'm going to assess why I'm also assessing her legs for a DVT. Make sure her legs are equal, no redness, no swelling, that there's no pain when I push her foot forward. I could also check reflexes and Babinski if I have the instruments to do so, which I do not. And that completes my neuro assessment. Okay, I'm going to continue with checking out your cardiovascular system. I'm going to check your pulses in your wrist, and then in your feet. If your shoes are off, if I cannot feel them, I will go the whole way up to the femoral and the axillary, but you should feel them if there are no clots. I'm also going to assess her arms and her legs for edema. Make sure there's no pitting edema or that everything's equal bilaterally. Going to listen to her heart with the bell and the diaphragm for murmurs, thrills, anything abnormal. With the diaphragm first. And I could also take an apical pulse. In a female, it's a little difficult. And back up with the bell. And I could have her lean forward to hear for any abnormal murmurs. I'm also going to check her neck for any signs of JVD, so turn your head to that side. And to my side. Okay, I'm going to check your capillary refill. Good, and turgor in the skin. Good. And next I'm going to check her respiratory system. Any shortness of breath?
No.
No, when you're getting up, moving around, any shortness of breath? Mm-mm. Are you coughing up anything, any sputum?
No.
No. I'm going to listen to her lung sounds. And again. And again. And again. And again. Again. And one more time. And could you turn to that side for me? Mm-hmm. I'm going to just make sure she's equal bilaterally as well. Deep breath. Good. I'm also assessing for the size of her chest. Make sure she doesn't have a barrel chest, which could be COPD. I'm going to now percuss. Okay, and turn towards me again. Make sure her trachea is midline, head up. Thank you. Okay, any nausea, vomiting, diarrhea, or constipation? No.
No.
Any belly pain of any sort? No. And I'm just going to palpate her stomach lightly and then deeply. Any pain?
No.
Nope. I'm also going to make sure that there is no distension, any firmness in her stomach. Make sure no ascites or anything like that. And listen to her bowel sounds in all 4 quadrants. And then I can percuss her abdomen. And you should hear what sounds like air throughout. Okay, go ahead and sit up. Is it done?
No, it's still working.
It's still working. Do you have any trouble urinating? No burning, no pain, no incontinence, no. And I'm going to just go through and look at her nails, her hair, her eyes, her ears, just a general skin assessment, and just make sure there's no redness, no rashes, no bumps, or any abnormal growths or anything like that. So we're going to just look in the ears. We did already check the eyes and the throat. Make sure her nose is equal, no occlusions. Check her nails, her arms, her hair. Make sure there's no lice, anything like that. Okay, and you are good. And that is the end of the assessment.